Welcome, and thank you for braving the cold weather to come to the official ribbon cutting ceremony of the WVU Children's Birthing Center operated by Uniontown Hospital. My name's Carrie Willits, and I am I'll get a little emotional here. I am the president and CEO here at Uniontown Hospital. Our organization's mission calls us to commit to excellence in patient care, and I can't think of a better example than this birthing center as our commitment to the 140,000 residents of Fayette County and the surrounding region. Following the ribbon cutting ceremony, each of you will have the opportunity to tour the birthing center and learn more about the planned scope of services. But for the next 30 minutes, we're going to celebrate the significance of what I hope becomes the first choice birthing center for more than 1,000 local families we have the potential to impact each year. What makes this initiative so unique is the support, partnership, and engagement that we have from so many local, regional, state, and even at the federal level. There is a reason why each and every one of you were invited to this event today. You have played a role of significance in moving this initiative forward. To the local team, geez. You really did the heavy lifting. Meredith Almer is our Chief Nursing Officer, and she was the executive sponsor. Dr. Larry Glad is the Medical Director. Beth Connick is the Clinical Director, and Dwayne Trippett, the Facilities Director. Thank you. To our hospital board members, elected officials, and community leaders, you have advocated and contributed time and resources. A special thank you to the individuals and organizations that are listed on the two posters in the back of the room. Combined, you have contributed $2 million toward a $5 million capital campaign to support infrastructure and programming. To our health system colleagues, CEO Albert Wright, our partners at Children's, and departments of obstetrics and gynecology and pediatrics, you are and will continue to be exceptional partners. And to the state leadership, thank you for learning with us and supporting sustainability efforts now and in the future so that we can be an example to other community hospitals and health systems throughout Pennsylvania and beyond. And a special welcome to Laura, who is representing Governor Shapiro's office. I'm now really honored to introduce a very special group of speakers who represent these various collaborations. Dr. Deborah Bogan. Dr. Bogan is Pennsylvania's Secretary of Health. Prior to joining the Commonwealth, Dr. Bogan was the director of the Allegheny Health Department and spent more than 2 decades as a member of the Pittsburgh region's medical and research community. Dr. Bogan has dedicated her career as a pediatrician to caring for children and families impacted by social inequities. Senator Pat Stefano. Senator Stefano was elected to represent the 32nd District in November of 2014. He serves Fayette, Somerset, Bedford, and Westmoreland counties. He is a lifelong resident of Fayette County and was a third-generation business owner of his family's company, Stefano Printing. Dr. Lawrence Glad. He's our medical director. Dr. Glad has 30 years of experience as an OBGYN and is an associate professor in the Department of Obstetrics and Gynecology with the WVU School of Medicine. He has committed his career to serving the women and families of Fayette County. Nancy Decker. Ms. Decker is the chairwoman of the Uniontown Hospital Board of Directors, and she has been a dedicated board member since 1990. She's the president and CEO of Laurel Institute, a multi-state organization dedicated to providing quality career-focused education and professional certifications in response to the needs of the regional employer community. Mr. Albert Wright. Albert is the president and CEO of the West Virginia University Health System. Albert has transformed the health system from a holding company to a fully integrated network of 24 hospitals and clinics across a 4-state region. WVU Health System employs 30,000 team members, including 4,000 physicians and advanced practice professionals. So thank you in advance to each of you for coming and sharing your remarks. I'll hand it over now to Dr. Bogan.
Good afternoon. What an amazing occasion. Thank you, Carrie, for the kind introduction. Thank you to the hospital leadership for inviting me to participate in this ribbon-cutting ceremony. As Carrie said, I'm Dr. Deb Bogan. I'm the Secretary of Health for Pennsylvania. Improving maternal health throughout Pennsylvania is one of Governor Josh Shapiro's top priorities, and adding a new birthing center here in Fayette County will improve outcomes for the area's mothers and babies. As a pediatrician, I have devoted my career to providing care to children and supporting their families. And I have seen firsthand the impact of quality birthing services on families and on the community. And I'm delighted that the West Virginia Medicine and Uniontown Hospital's commitment to providing this maternity care option for residents right here in your own community. Currently, Pennsylvania, like the rest of the nation, is experiencing a maternal health crisis. The rate of pregnancy-associated deaths has been on the rise in recent years. In 2020, Pennsylvania experienced 83 pregnancy-associated deaths per 100,000 live births. That translates to more than 100 Pennsylvanians dying each year during pregnancy or in the year after delivery. Also of concern is our rate of severe maternal morbidity during birth hospitalization specifically, which includes things like hemorrhage, respiratory distress, cardiac conditions, sepsis, and others. The rates of these severe conditions have been also increasing, and in 2022, the rate of severe maternal morbidity was 105 per 10,000 delivery hospitalizations. Sadly, Black women in Pennsylvania are nearly 2 times more likely to die during pregnancy or in the year after giving birth than white women. And similarly, they are also twice as likely to experience severe complications. We can and we must do better. The U.S. rates are significantly higher than our peer countries like Canada. So why am I sharing this data with you today? Because birthing centers like this one are vitally important to improving pregnancy and birth and maternal outcomes. The dedicated health professionals working here, when this facility opens very soon, will help ensure that mothers are listened to, their health and wellness needs are met, and their babies enter this world safely. Both from my experience as a mother and as a pediatrician who spent 25 years providing care to families with a new baby, birth hospitalizations can be incredibly joyous, but they come with many challenges as well. They have challenges like mothers have fatigue, families have fatigue, the pain, up and down emotions, financial stress, health issues. I could go on. But meeting the staff here today, you are clearly prepared to address these challenges by providing each family with personalized, supportive, kind, and respectful care. And I'm happy to say that your efforts align very well with the Shapiro-Davis administration's commitment to maternal health. Since taking office, we across the administration have prioritized addressing maternal health disparities and improving access to quality health care for all. Along with our partners in the Departments of Human Services and Drug and Alcohol programs, we are in the process of developing a maternal health strategic plan to support initiatives to care for women and their babies. This year, the governor secured $5 million in the budget for maternal mortality prevention. With this funding, the Department of Health new division, the Division of Maternal Health, is working to get funding on the streets to address maternal health priorities. And one of the reasons I'm here today, besides celebrating the amazing opening of this new facility, is to demonstrate how important your role is in supporting maternal health in Pennsylvania. We must ensure that every woman has access to the highest quality care before, during, and after pregnancy. And you are ensuring that for women right here in your community. So again, I thank you for this really important effort. I am sure the families that will benefit from this are also going to thank you in the many years to come. It's truly a pleasure to be here, and it's now my honor to turn things over to Senator Stefano.
Good afternoon. It is an exciting day, and I'm glad to be able to celebrate with you. There's a lot of great team members here today. I want to say some special thank yous, especially to WVU Medicine. Thank you for your investment in our community. As I was saying earlier to Carrie, I said everything old is new again. And here we are being able to complete that circle again and go back to where we needed to be. If you look across the 32nd district, and you just heard the counties that I represent, they are all birthing deserts. Due to all the changes in our healthcare system, how difficult it is these days, they've all had to close their centers. And I'm glad to see here in Uniontown Hospital that we're going to be opening, we're going to celebrate today by cutting the ribbon of opening the new center again and changing that trend and going back to where we need to be. Because our parents were leaving. They were leaving, going to other areas. And as you heard some of the numbers, keeping them here at home is going to be so much more of an improvement. We have challenges ahead of us, but I'm sure all of us here working together, as you have done to be able to open the center, we're going to be able to surmount those challenges and prove to the rest of the state, we can do it here, you can do it anywhere else. And we'll be the leaders to show you. And I think we have the great team here to be those leaders to show the rest of the state what to do. So I'm so excited to be able to contribute my part from the state to help, and the rest of you have done the same. And I look forward to cutting that ribbon and changing the trends in Pennsylvania. So thank you all for all your help in this exciting day. And it's my turn now to introduce Dr. Glad, who will now speak with you.
Thank you, Matt. Good afternoon, everyone. Before I begin my remarks, I'd like to say one thing off the cuff. My wife told me not to because she knows that I tend to ramble. But as I look around, I see friends, I see family, I see mentors, I see people that have influenced my career, I see people that I've been blessed to deliver their babies, and it's the greatest honor in the world to say that we're here as a community to reopen the birthing center, and I thank everyone for their opportunity to speak here today. So again, Mr. Wright, Ms. Willits, Ms. Decker, Senator Stefano, and Dr. Bogan, thank you everyone for this opportunity, and I greatly appreciate the chance to share my thoughts as we prepare to reopen the WVU Children's Birthing Center here at Uniontown Hospital. WVU Medicine's commitment to providing health care to the women of southwestern Pennsylvania continues with this important milestone. It's restoring access to one of the most fundamental needs of the women in our region, the ability to give birth close to home. In my 30 years of medical practice, I've witnessed so many changes in the delivery of care for pregnant mothers. Nationwide, the availability of obstetric care has become increasingly limited. I commend Mr. Wright and WVU Medicine for their efforts to expand that access to women's health care in our community. With the reopening of the birthing center here at WVU Medicine, Uniontown Hospital, a unified team of providers, including certified nurse midwives, nurse practitioners, physician assistants, and physicians, work together to provide high-quality obstetric care for our patients. Additionally, high-risk pregnancy care, including specialized ultrasound services and high-risk physician specialists, will be available here in Uniontown. Along with that, the collaboration with high-risk pregnancy specialists in Morgantown, West Virginia, means that our patients will have access to all the advanced care that they'll need. If any services are not immediately available in Uniontown, they can be assessed through specialty services in the Morgantown area at WVU Medicine Birthing Center at Children's Hospital. Most importantly, our patients will receive care from one cohesive team of physicians and healthcare providers, so that everyone working together with WVU Medicine is a part of that family, making sure that those mothers receive the care they require. As someone who, about 61 years ago, come January, was born here in this hospital, it's especially meaningful for me to be here. But as we see the reopening of the Children's Hospital Birthing Center, I look forward to delivering one thing: new Mountaineer fans. We'll be delivering those babies, and everybody's going to be rooting for WVU. Thank you all very much, and have a great afternoon. It's my honor. It's my honor to introduce Nancy Decker, our chairman of our medical board.
Thank you so much. Thank you.
Good afternoon. Good afternoon. You know, I always say this to my students: you can do better than that. Good afternoon. Good afternoon. Much better. This is an exciting and happy day. Probably one of the hardest days that I've had as my service on the Uniontown board is in 2019 when we had to make the very, very difficult decision to close labor and delivery in Uniontown Hospital. And it was with heavy hearts that the board made that decision. We made it back then because we were an independent hospital, and it was the way that we saw that we could continue to have a hospital in Fayette County. And the focus of the board has always been providing community health in Fayette County. It's been our goal, and we were able to do that by closing. Then our next big step was to merge with WVU Medicine, which was probably one of the best steps that we made during my tenure on the board. We learned that you can't make it on your own as an independent hospital in most cases, and we found a wonderful partner with WVU Medicine. Immediately upon that merger, one of the things the board started talking about was, can we bring back labor and delivery? And we've been working on that since then. You notice, if you see, we brought back a lot of services, built out a lot of services in the community, because WVU Medicine is committed to Uniontown. They're committed to the sustainability of the hospital here, providing the services for our community, and continuing to expand and grow those. And the one that we're here celebrating today that's going to have a huge impact on the mothers in our community is the reopening of labor and delivery. And I know that a lot of the people working in that department were the ones that were here when we closed it. And I know they're pleased to be back doing what they have a passion for, caring for mothers and babies. And I'm honored on behalf of the board of directors to be able to stand here today and say, labor and delivery is back to Uniontown, and we're able to continue to serve our community in the way that they need to be served. And again, thank you to the state for your support with this, and thank you to Mr. Wright and WVU Medicine, and we are pleased to have Dr. Glad as our chair of this department. So thank you very much, and it is my pleasure to introduce Mr. Wright.
Good afternoon, everyone. I love when we have groundbreakings and ribbon cuttings. Those are my favorite days. You know, a lot of work in between, but that kind of makes it all worthwhile when we get to have these types of days. So we were very blessed at the WVU Health System 5, 6, 7 years ago when Uniontown Hospital chose us as a partner, right? This is a great hospital, great community, and has significant opportunity for us and this community. And, you know, I remember talking to the leadership team here, the board of directors here, and our board of directors and leadership team back in West Virginia, that I believe we were the right partner to make this work, right? We are, the way our healthcare system is set up is we're structured to give support to community hospitals like this one. And when they do well, they keep their dollars in their community to reinvest. We don't sweep them back to Morgantown, right? You know, and so as I've watched over the last few years with great excitement and admiration as the leadership team here continues to invest new services back into this community, whether it be urology, whether it be ENT, whether it be orthopedics, whether it be neurosurgery, whether it be cardiology, whether it be cancer. These are all things that have added back. I've watched this hospital go from a distressed asset to one that is now flourishing and doing well. And again, we don't sweep those dollars back to Morgantown. If we did, Gordon Gee would be calling me to help hire a football coach, right? But I said, Gordon, those dollars stay in Uniontown, right? And so today's really the cherry on top, right? That we get to bring back labor and delivery. Because I remember how painful it was to take that away. To bring that back is exactly what we should be doing, right? This is the sole, essentially, this is the sole community provider of Fayette County, right? And a hospital of this size and scope and service should deliver babies, right? And if you think about it, right, that's a core service, a core responsibility of what we want to do. And if you think about it, a lot of times for young adults, their first experience in a hospital is when they have a child. And thank God, most of the time, that's a very positive experience. So we want those young families to have their children here, and stay in this community. And then when they need more health care, they'll come back to Uniontown Hospital and WVU Medicine, and then it will all work out great, right? So that's what we want to have happen. So this is a very exciting day for us, and it's an exciting day for Uniontown, okay? Now, with that said, this is an expensive venture, right? Because whether you have one baby or 1,000 babies, you got to have that same infrastructure, right? You got to have nurses around the clock. You got to have doctors around the clock, right? We got to have all of that equipment, okay? So I didn't come here to talk about the birds and the bees, but some of you still have reproductive capability in this room. And as the holidays, slow down, you have some time off, we need you to take one for the team and think about having some 2025 Uniontown babies. Thank you, everyone, for being here today.
He said he wanted to talk last. Thank you, Albert. Thank you. Just as a show of hands, who was born here? How many?
Right here.
Yeah. Turn around. Yeah, pretty awesome. So inspiring. Well, thank you. Thank you again to all of our speakers and for everyone who's contributed to the opening of this service. So just a couple logistics. We are going to allow everyone to have a tour of the birthing center, but we don't have enough space for everyone to go upstairs for the ribbon cutting. So we have a handful of folks, and they know who they are, to go upstairs with us to do the ribbon cutting, and the rest of you can stay down here, enjoy some really wonderful food provided by the Stonehouse, and we will live stream the ribbon cutting from on the large television here in the front. And then following that, we will take groups of folks for tours of the center. So thank you so much, and enjoy your afternoon and be safe.